Hello, my name is Jennifer, and I'm the Executive Director of the Charitable Pharmacy of Central Ohio. Thank you for joining me today to talk about a local answer to a national crisis. As we all know, access to prescription medications in our country is a barrier for many people. Most of us have been to the pharmacy counter and been shocked at the cost of prescription medication. Imagine living on $700 per month of Social Security income and taking 8 medications that cost over $100 per month. That's the reality for our patients at the Charitable Pharmacy. But the good news is that in Franklin County, Ohio, we've done something about it. You've tuned in because you're interested in starting a charitable pharmacy in your community. So let me give you a whirlwind tour of how we started and how we're structured today, 9 years into our operations. I like to say that the right people came around the right table to start the Charitable Pharmacy. People in the community who were working on housing and food insecurity were seeing a recurring theme. The people they were helping were not able to get critically needed prescription medication. So some caring people, including community leaders, healthcare leaders, business leaders, and members of the West Ohio Conference of the United Methodist Church, came together and said, we need to see if we can do something about this. They took a trip to Cincinnati and were inspired by what they saw at a fellow charitable pharmacy there. It took 2 years of planning before we opened, and another useful piece to the process became available. A 2008 Ohio Department of Health survey was released, which said that in Franklin County, there were 149,000 people who reported going without prescription medication due to cost. 149,000 in our county alone. A clearly defined need for the charitable pharmacy. As you consider starting your own charitable pharmacy, it will be important to determine the need in your community. Start with your public health data. Next is getting down to business. Our local group of leaders started looking for their first executive director, a pharmacist who was passionate about the mission and who could execute a business plan. And they found that in our founding director, Alan Zanger, who served for 5 years with passion and vision. A business plan is necessary to start to enlist support and define the needs of the organization. The Charitable Pharmacy started in 2010 with just under $250,000 in support, primarily from local government, health systems, and individuals. Enlisting support is crucial from here on out and has been for the last 9 years. Not everyone understands the need for patients to receive medications without an obligation to pay. One of the most important things that I do as the executive director is advocate for patients and make the case that our patients deserve to have access to their prescription medications, regardless of whether they don't have insurance or have insurance but can't afford the high copays and deductibles. At this stage in the process, after the right people have come around the right table, the need has been quantified, the business plan created, and a passionate executive director has been hired, enlisting support comes from 2 phases. First, you need a fantastic, dedicated, supportive, and resourceful board of directors to create a mission and vision for the organization. Our business plan came first when the board was assembled, and then the mission and vision were developed. By the way, our mission is to provide affordable and effective medication and pharmacy services, and to coordinate healthcare for those most vulnerable in our community. And there's a lot of meaning in that mission for us. We encourage you to visit our website and check it out. Back to enlisting support. Once you have the team assembled for the board and an executive director, you'll need community support, especially financial support. Our county and city governments see value in our most vulnerable neighbors getting their medication. Our local health systems all provide support, as do several businesses, our local community foundation, other local and regional foundations, and an incredible group of individual supporters. We are also a United Way partner and we have an annual bike ride fundraiser in May. We take up 2,000 square feet inside the Livingston United Methodist Church, which is in downtown Columbus and is on 2 bus lines. We are licensed by the Ohio State Board of Pharmacy, and the pharmacy has a board-approved security and alarm system. We get medication from 7 donated sources, and we purchase from 3 wholesalers. Another substantial inventory source for us is our repository program, which is legal in most states, but be sure to check with your state board first. The repository program allows us to take unexpired medication from long-term care facility pharmacies or doctor's offices. We view this as the ultimate recycling program. There's a lot of labor involved in our inventory process, especially to sort and repackage those recycled medications. We also have an abbreviated formulary on our website of our most commonly dispensed medications. From the moment we opened our doors to this day, we have been dedicated to personalized service. We sit down one-on-one for an average of 25 minutes with each patient every time they come in. In 2018, we conducted nearly 10,000 one-on-one consultations. I have to tell you that the way our community supports this type of personal care is incredible. Early on, we developed a very close relationship with the Ohio State University College of Pharmacy. We started with 1 advanced pharmacy student with us each month and have grown to now having 5 students with us each month. These are students who have completed their coursework and are now gaining real-world experience under the supervision of a pharmacist. There's no way we can have this positive impact on our community without this relationship. And in 2012, we also added 2 community-based pharmacist residents from OSU's residency program who practice with us for a year. In addition to our students and our residents, we've built a passionate, mission-driven staff that work to make life easier for our patients. Even with all of them, there is still more that needs done. We are fortunate enough to have a dedicated team of volunteers who donated 5,000 hours of service in 2018. We couldn't do this without them. I can't stress enough the importance of enlisting support on your journey to start a pharmacy. First, as you form your board of directors. Second, as you seek funding from the community. And third, as you look for community partners to help you meet your goals and fulfill your mission. One of the ways we work to gain support is to demonstrate our outcomes through published research from our practice. We've published 5 articles on the following topics: a reduction in hospitalizations, self-care in the improvement of mental health, airway medication access barriers, our use of an electronic health record, and a reduction of healthcare insecurity. Advocacy, scholarship, and research are very important to us as we continue to demonstrate our local answer to a national crisis around prescription medication access. My hope is that this video was able to provide insight and direction as you decide if the charitable pharmacy model is right for you and your community. And finally, I wish you the best of luck on your journey. And thank you for caring for the health and wellness of your community.